Okay, good morning, everybody. I am Robert Kargougou. I am a medical doctor with a master in public health and with competencies in nutrition. I have more than 15 years extensive experience in managing, strengthening health systems, and in designing, implementing, monitoring, and evaluating health and nutrition programs for women and for children. I have occupied different positions in Burkina Faso health system as a district medical officer, then chief of the Service of Disease Control and Promotion of Specific Groups at regional level, and then regional health director in 2 regions, East and West Center regions. And after that, I have been appointed at UNICEF country office as nutrition officer. And after that, I have been appointed as General Secretary of the Ministry of Health. And now currently I am GFF Liaison Officer for Burkina Faso. So I am making this presentation on behalf of Dr. Marie-Laurette, who has been recruited as consultant, EQUIST consultant for our country, and myself. And this presentation is entitled, as you can see, EQUIST Analysis in Burkina Faso, Data Updating Process, Impact on Quality of the RMNCH Investment Case, Lesson Learned, and Way Forward. Prior to continue, I have to say that the country has benefited from the support of Global Financing Facility, the World Bank, and UNICEF for EQUIST analysis. I propose to do the presentation regarding this outline. Firstly, a global context, then data updating process, methodology of country situation analysis, impact on RMNCH and investment case quality, a lesson learned, and I will finish with suggestion. So, regarding to the global context, you will note that in September 2017, Burkina Faso was officially accepted to benefit from the Global Financing Facility in support to initiative Every Woman, Every Child. Therefore, the country was engaged to elaborate an investment case on RMNCHN with address particular delays in achieving some targets and the inequities for better impact and equity. Moreover, our President Kabore, was nominated to co-chair the Global Financing Facility Replenishment Conference in Oslo in November 2018 with the Prime Minister of Norway, Erna Solberg, and the World Bank General Director and the co-chair of Bill and Melinda Gates Foundation, Melinda Gates. And when we have done a quick review of literature, this shows that EQUIST tool was used by some countries to better analyze and formulate their investment case. So the country, in collaboration with the World Bank, the GFF Secretariat, and UNICEF country office, and UNICEF headquarters, and European Union, had recruited some consultants to do this work. So the European Union helped the country to recruit 3 consultants for the global formulation of the investment case, and a specialist consultant in EQUIST, Dr. Yasse, who will join us was recruited by the GFF and the World Bank with the technical support with UNICEF to accompany the process. So these slides show the global methodology we use to formulate the investment case. This is a mixed methodological approach to ensure national ownership in the process of developing the investment case, and also to be sure to have the investment case before Oslo conference that I spoke about. So we have set up some groups, some work groups. And so, but before, in the process of developing an investment case, GFF Secretariat advised to do a mapping of specific and cross-cutting intervention stakeholders in the field of RMNCH. So we do, firstly, this work with the support of Bill and Melinda Gates Foundation. After that, we set up a group to do the performance gap analysis. So this group had to see what are the main gaps performance in the country regarding RMNCHN. We set up also another group to secure the financing of the RMNCH investment case. It is very important for us to know what funding we have, what are the gap funding we have, and also how to engage more private sector and to more engage also government in financing RMNCH investment case. And we also set up a group to prioritize cost effectiveness and specific and cross-cutting interventions. And so these groups was composed of technical financial partners and also with government officials. And these groups works hardly, and then when we hired the three consultants make a consolidation and consistency to formulate the investment case. So this mixed methodology ensures the country to have an ownership of the process and also to have the investment case fastly before the conference in Oslo in November 2018. So, Burkina Faso EQUIST data update process. As Charou mentioned in his great presentation, the data process is a very important step when you want to use EQUIST. And Burkina Faso data in the EQUIST tool dated from 2010 DHS, while the country conducted a continuous multi-sectoral survey in 2015 with a health module. The country also conducts regular specific survey since at least 5 years as National Nutrition Survey with the SMART methodology and Service Availability and Readiness Assessment SARA survey, and also. And it is the data from these surveys that are mainly used by the country in anticipation of the conduct of the DHS 2020 and other surveys. So EQUIST administrators was agreed to have an update of Burkina Faso data into the tool. So to achieve this, a collaborative work between three teams were necessary. Firstly, EQUIST administrator, the group in charge of performance gap analysis. You remember that in the methodological approach I spoke about it, and the General Directorate of National Institute of Statistics and Demography. I must also say that officials were copied in the different exchanges, discussions we have with UNICEF headquarters, Dr. Balaj, EQUIST administrator, and the Minister of Health himself, the Secretary General of Ministry of Health, and some directorates from Minister of Health was copied in the different mails we have. And also, as I say, EQUIST administrator, UNICEF headquarters with Dr. Balaj, and UNICEF country office, and also World Bank country office and GFS secretariat. So I think having all these officials keep informed of the process with in focus Oslo conference have been very essential to accelerate having certain data to fill in the template that EQUIST administrator sent to us. And the core members of the group in charge of performance gap analysis support filling certain items with the strong support of the National Institute of Statistics and Demography. Indeed, this institute accepts to provide us with the Excel spreadsheets of the health module of the 2015 multi-sectoral continuous survey. And moreover, I must say that the General Director accepts to delegate one of his team members to extract the relevant data we need for us. We also used some data from DHES2 and other sources. However, not all data could be updated due to the short time required. Some internal problems that occurred in the Ministry of Health because it was at a period the Ministry of Health had a new organization, and the unavailability of certain disaggregate data as maternal mortality. And you can see in the next slide. So what was the methodology of country situation analysis? The analysis of the country situation with EQUIST tool took place in two steps. Firstly, we generate and analyze the country profile results from the 2015-2016 EMC survey database that have been uploaded by the EQUIST team into the tool database. And secondly, we construct scenarios based on the analysis of the situation carried out by the functional team number 7 and during the capacity building of the members of the EF7, including the technical and financial partners, the civil society, in nutrition and health reproduction. I should mention that a limitation was identified in the analysis related to the inadequacy of the data that was made available to provide the updated basis for the EQUIST tool. So now, what is the impact of EQUIST analysis in quality of RMNCH investment case? The expertise provided by EQUIST analysis contributed to give more validity to our investment case. Indeed, a rigorous and systematic analysis allowed us to respond to the following questions. What are the levels by regions, rural and urban, wealth quintile, and main causes of maternal, neonatal, and infant death in the country? So using EQUIST analysis allow us to have some response to these questions. What are the bottlenecks and the causes of these bottlenecks? Also using EQUIST analysis allow us to have answers to these questions. And what are the main high impact interventions and strategies to address this situation? And then the impact of the implementation of these strategies, we have it in using EQUIST tool. So, to be more clearly, concerning maternal mortality, as you can see, even if the rate decreases from DHS 2023 to EMC 2015, that established at 330, you can see that the rate of the maternal mortality remains very high in Burkina Faso. And the main causes are indirect causes, also maternal hypertensive disorders, and maternal sepsis and other infections. So it is EQUIST tool that allow us to have the causes of maternal mortality in Burkina Faso. And as I say, in Burkina Faso, we couldn't disaggregate the rate of maternal mortality by region because of the unavailability of this data. So concerning newborn mortality, we have a remain high newborn mortality rate with geographic and socio-economic inequities. Indeed, as you can see, the rate established at 25%, and we can note that some regions as Sahel regions, Haut-Bassin region, Boucle du Monde region, East region have newborn mortality rate above the average of 25 for 1,000 live births. And we can also note that this mortality rate is more high in rural areas than in urban areas. We also noted that this death rate is in disadvantaged population was at 28 against 25 in a rich population. And concerning the causes, low birth weight and prematurity, intrapartum complication, and severe infections and pneumonia are the main causes that we observed in Burkina Faso. And there were no differences by region concerning the main causes of newborn mortality in Burkina Faso. Concerning under 5 mortality rate, we noted that we have a high under 5 mortality rate with inequity factors affecting region, distribution, area of residence, rural, urban, and socio-economic level. And as you can see, the under 5 mortality rate stated at 80 per 1,000 live births, and some region as Sahel region, Haut-Bassin region, Boucle du Monde region, Southwest region, East region are again the region where the under 5 mortality rate is very high, establishing above the average of the country. And as you can see in this graph, the more you are in the disadvantaged groups, poorest, the higher is the under 5 mortality rate. Indeed, as you may see, in this group, the poorest group, the under 5 mortality rate is very higher, and in the rich group, the 5 quintile, the under 5 mortality rate is down. And the main causes of neonatal causes were malaria, pneumonia, and diarrhea. And the distribution of causes is similar at the level of the different regions in the country. So, with EQUIST tool allowed us also to have the level of high intervention in the country. And here you can see that the majority of regions are below 50% coverage for tracer interventions, excepted for the practice of sleeping under an insecticide-treated mosquito net, as you can see. In the preventive care package, vaccination is the intervention which have high coverage, as you can see, in green here. And for antenatal care, in red, we have it. And family planning in blue. So for the preventive care package, vaccination is the intervention which has high coverage. So concerning bottleneck analysis, EQUIST has been used to perform the bottleneck analysis and the causes, and this allowed to have an analysis according equity and to have cost effectiveness and high impact strategies. And this analysis has been conducted given to the 3 delivery canals, and Charu has talked about that. Family practices, package canal, preventive care, and curative care. And for each canal, the 7 coverage determinants have been analyzed and allowed to have the main cause of bottleneck. Okay, concerning family practices bottleneck analysis, the package analyzed was WASH, ITN, HIV/AIDS, maternal and infant young child feeding, and globally we found that continuity and quality care are the main bottlenecks found at community level. Then human resources, availability, and socio-cultural acceptability. Concerning preventive service package bottleneck analysis, the package analyzed was family planning, antenatal care, child immunization. And the main bottleneck were low social cultural acceptability was found for all interventions and is linked to women low capacity in decision making and lack of information about the usefulness of antenatal care. Low accessibility of human resources in antenatal care, inadequate distribution of human resources, low capacity in pregnant women diabetes case management. With regard to the inadequacy of the quality of family planning services, the causes that explain this situation are insufficient compliance with standards and protocol, patient safety, biomedical waste management, and condition storage of products. Concerning curative service delivery bottleneck analysis, The package analyzed was IMCI, skilled birth attendance, emergency obstetric and neonatal care. The main bottlenecks were found was supply availability, geographic access, socio-cultural acceptability, and quality of care. So, EQUIST analysis contributed to prioritize regions for interventions in Burkina Faso. And as you can see on this map, we divided the country into 3 groups of regions. And the first group is the group of regions that have a high-level priority. And this group comprises Boucle du Moun region, the Sahel region, the East region, and the East Center region. And this means that if the country do not have a lot of money, the country have to prioritize this group of region because, as you remind in the slides, these regions had the higher burden of disease concerning the targets under 5 children and women. And the second priority of region is Cascade region and Sud-Ouest region and Haut-Bassin region. And then the third group of region is the Central region with the capital in Ouagadougou, the North Central region, and then the Plateau Central region. So EQUIST analysis contributed to allow country to prioritize the region for the interventions. Concerning the impact, as you will see on the graph below, we compared the number of deaths averted in our scenario with the number of deaths at the limit of equity and at the operation limit. For the limit of equity, it is a matter of raising the coverage of high-impact intervention of the most disadvantaged population to reach the same level as those of the least disadvantaged populations of Burkina Faso. Concerning the operational limit, it is a matter of putting the coverage of high-impact interventions of Burkina Faso at the same level as that of the best performing countries to avoid the maximum death. And as you may see on this graph, the number of newborn deaths that could be avoided in our scenario is about 5,000 deaths by moving up the coverage of high-impact interventions above the limit of equity. So here is our scenario that could be avoid 5,000 deaths by moving up the coverage of higher impact interventions. And here is our equity limit, and here is the operational limit. In this graph, in our scenario, when bottlenecks are lifted with an increase of high impact interventions, it helps to avoid 10,000 deaths of under 5 children. And as you see it here, we have our scenario that can avoid 10,000 deaths of under 5 children. And here is our equity limit and the operational limit. And here you have the different causes, and we have the contribution in the death avoided. So, what are the lessons learned? We learned that EQUIST is a powerful tool to make a systematic analysis of disparities and to tackle inequity. And as you may remember, in the slide I show, you see that the burden of disease is different among regions and among residencies. Secondly, we learned that data constitutes a challenge when using EQUIST. It is really, really important to take time to gather all needed information. We also learned that involvement of National Institute of Statistics and Demographic is very important. And we also learned that performing an effective EQUIST analysis needs availability of various stakeholders and more time. It is very important to take more time to do this analysis, to gather all the information and to involve all the various stakeholders when you want to perform an EQUIST analysis. So at the end of this work, what are the suggestions we can make? Firstly, we suggest to refine some data because, as I say, we do not have a lot of time to gather all the information. Secondly, we suggest to organize capacity building on EQUIST at country level, as the turnover of human resources is very high in Burkina Faso. So it is very important to build capacity and more people to be able to use this tool. Firstly, it is important to analyze the possibility to design EQUIST to be used at region and district level, as it is at these levels that results are performed. And lastly, we suggest to reinforce collaboration between UNICEF, World Bank, GFF Secretariat, and Global Center for Research of Edinburgh University in supporting countries, and specifically GFF countries, in the investment case development process, and to document them. So this is what I would like to share with you, and I am available for your questions. Thank you very much.